I'm also pleased today to be able to announce that round one of the vaccination enhancement grants program for those priority local government areas in Melbourne have been finalised. These are the GP and community pharmacy grants to allow them to employ more staff, expand their hours, rent additional space, fill out additional space. Ultimately, they're grants that allow them to get more jabs in more arms than would otherwise be the case. Round one has now been finalised. There are 300 GPs and community pharmacists who will be sharing in that $1.5 million in additional support. It's common sense. It's absolutely about doing those very practical, very local things that can make a big difference to the number of people who are moving through those settings. Many GPs and community pharmacies have been supported through round one, and many of those are located in those 27 postcodes that I just referred to, places like Deer Park, Hillside, Caroline Springs, Rockbank in the west, Footscray, Kensington, St Kilda. So a broad cross-section, and many of those targeted grants are in fact in the very postcodes where we want to drive more vaccination uptake. That is more than we had planned to invest, more than we had first offered up, but we've been overwhelmed with community pharmacists and GPs coming forward wanting those grants, so it just makes sense to provide that funding so they can, as I said before, employ additional staff, operate additional hours. We've had lots of different stories. One primary care setting where I think there's a second floor. They're going to fit that out and turn that into a specified vaccination hub. Others that have told us they'll be able to double the number of patients that they can vaccinate each and every day. So it's just a really significant investment in getting more jabs in more arms. Now, before I ask Naomi and then Kate to speak to their respective responsibilities, I just wanted to preview, we've got two special guests with us today, Kim and Will. They've both had COVID. Kim spent a period of time in intensive care. She's well now, but her story, as well as Will, who still 18 months on deals with the consequences of having had COVID, their stories are, I think, very powerful. They're very real stories of just ordinary, hard-working Victorians struck by this virus and having to live with the consequences of it many, many months later. You've often heard us say from this podium that no one wants to get this. It is not a pleasant thing. And there are different ends of the spectrum. Some people with very mild symptoms, some people who finish up gravely ill. But it's always good to hear from ordinary Victorians. Their stories are powerful. Their stories are, I think, a great motivation, if you needed one, to go and get vaccinated. There are appointments available. We want to get to 70% double dose as quick as we can, then 80%, be open, be free, normalise this. We know that'll be a tough time for our health workers. It'll be a tough time for our health system, but there's no alternative. It'll be easier. It'll be less traumatic in our health system the more and more people get vaccinated. So for the system and the sake of our nurses, for freedom and getting this lockdown off, and to avoid becoming gravely ill, and to avoid becoming one of those, not just the sort of statistics we read out at the extreme ends, but one of those many thousands of people who's today, many months after having contracted COVID, still live with the consequences of it. For all those reasons and more, please book a vaccination appointment today. Please go along and be part of protecting yourself, your loved ones, and indeed playing your part so that we can all get back to something approaching normal. I'm now going to ask Naomi to speak to some vaccination matters, then Kate, and then we'll hear from Will and Kim.